Hi, my name is Dr. Ducheine. I'm a former general and bariatric surgeon, that is weight loss surgeon. I've been working in the New Jersey area since 1995, and I'm here today to talk to you about med spa and also fun sculpting. Now, I've been involved in the field for a very long time, but I've decided to make the transition to med spa especially after the pandemic. We noticed that because of the Zoom issue and also technological advances done in the field, a lot of people became concerned about their overall health, overall well-being, particularly the appearance. People became self-conscious whenever they're looking at the monitor, especially in Zoom. So also, a lot of people that I've operated on that did gastric bypasses and they lost the weight, although they were healthier, but the feeling of self, the feeling of well-being was not there because the outward appearance they were not too happy with, especially with the skin and the laxity. So a lot of them were asking, Doc, why don't you do something to help us in terms of making us feel as good as we can feel and also look as good. Hence, after a couple of years of study, I've transitioned to elegant aesthetics med spa. And our motto currently, based on what they asked, was feeling and looking your best with elegant aesthetic solutions med spa in New Jersey. And as we said, we're going to talk about fun sculpting. Now, a lot of these people, after their initial surgery where they lose the weight and they got this excess skin, part of what we'll do with them is to help them jumpstart their fine tuning, the body contouring. Now, fun sculpting is been around really for about 10, 15 years. Is the new version of lipo, what people used to call liposuction. Now they call it fun sculpting, or they also call it high definition body sculpting. What is it? Basically, it is a procedure where we use a mechanism. That is, we use an instrument that uses vibration, and this vibration helps to loosen the fat cells so they can be aspirated safely out. Now, there are a lot of other means of doing body contouring. If we go back, there's straight lipo-suction back in the days, or still now, some individuals need what's called tummy tuck. Tummy tuck is basically when you folding the muscles together when the muscles are out of shape to make the stomach tighter, and then they do the liposuction to do the body contouring. That's usually done under general anesthesia, and they're usually done in a hospital. And also, the downtime associated with that is a couple of weeks, because usually after the um, tummy tuck, they make an incision. They have to replace your belly. They have to put drains, and the recovery in a minimum is 2 weeks. That is your out of work. Well, fun sculpting, we do it in a office environment. We don't use general anesthesia. We'd use local, what's called tumescent anesthesia, and you're wide awake. Most of our patients listen to music as we're doing the procedure. They may not remember much because we give them medication to make them feel comfortable, but they are wide awake. And after the procedure, depending on how much that we do for them, they go straight home. And the most medication they take for pain is Tylenol. For example, I had a gentleman who basically had a 1 pack. Now he has a 6 pack because of the fun sculpting. We're able to chisel to make him be much more aesthetically pleasing. So now he's very, very happy, and he could, as he says, fits better into his shirt. Now, who is a candidate for fun sculpting? Well, not everybody is a candidate. Certain people with certain diseases, like if you have particular, let's say, if you have infections, if you're pregnant, if you have cancer, if you have some blood clotting issues, usually, or something called scleroderma or autoimmune diseases, you would not be a good candidate. But most people can be a candidate for fun sculpting. Also, if you if you have no fat, that is, if your body mass index is below 18, you would not be a candidate for fun sculpting. So, therefore, we don't really have a body mass index restriction per se, but we carefully have to choose our patients anyway, because ultimately everybody's focused on the results. And some people, even though they've had the fun sculpting, they may need a little body, what we call skin tightening after that. So it depends. Everybody's an individual, customized base in terms of what we do for them in terms of fun sculpting. So again, not everybody's a candidate, but most people can fit under. Now, as we were saying before, fun sculpting is a better modality to do body contouring than others because it has less side effects. That is, for example, when we're talking about the initial liposuction from before, where even in surgery there are more risks. Let's say there's something called embolism. That's when pieces of clot leaves the veins and travels to the lungs or the heart. There's fat embolism. These are higher or more frequently associated with traditional general surgery where they put you to sleep, and then fun sculpting. And we talked about also the fact that you have the surgery or you have the procedure on Friday and you're wide awake, you're able to walk home, and the next day you're functioning. And I'll give you the experience of one gentleman that we did a week ago. He came in, and again, his body mass index was about 31, 32, and his key thing was he wanted to fit into his shirts better. And so he came in after we made some preliminary blood tests just to make sure he was not anemic, because anemia is a relative contraindication, and his blood clotted the normal way, not pro blood clot. In other words, he doesn't make clots easily, and also he can clot regularly. He doesn't bleed easy. So when he came in, we do a full evaluation with a physical exam, did the blood work, and we made sure he had no contraindications to fun sculpting. Then after that, we asked him what he wanted in terms of what outcome he desired, and we made some suggestion in terms of, since he was, again, body mass index was 30, he wasn't excessively fat. He had some love handles and a little paunch, as most people in their 50s get. Then he came here. We gave him, after he signed the appropriate procedure consent, we gave him some antibiotics to make sure to decrease the risk of infection. And then we took him to the procedures room. We make sure that we use aseptic technique. In other words, to make sure that we reduce the risk of infection. And after that, we gave him some medication to relax him. And once, after having achieved the proper level of relaxation, we again cleanse his skin with antiseptic solution, betadine, and then we marked him. In other words, we outline on his skin exactly where the cuts were going to be so that he can be happy. In other words, his body will look like, as we said, a six-pack. So then we infused what we call tumescent solution, which is a solution that has saline, it has a little bit of adrenaline, and some what's called sodium bicarb. But anyway, the technical aspects are not too important. What we did is that after we put him on the procedures table, we infiltrated, that is, we infused that solution under his skin, and then we let it work for about 30 minutes. What the solution does, number one, it's make the fat cells a little bit more relaxed. It also shrunk the blood vessels so that they don't bleed, and it made it easier for us to aspirate the fat cells as we use the ultrasonic handpiece. So then we, following this little place where we made the incision, we usually start around the area of the love handles. So we just aspirated that. And we went from the love handles on the left side into the right side. There's no right or wrong way. It's just what your ultimate goal is, what's easier for you to start. And I usually want to start where there's the most fat. Then we started there, and we also from the right side, where again most surgeons stand when they're starting an operation, unless they're left-handed, then they stand on the left side. We started the upper abdomen. The abdomen is again the belly, as most people call it. We divide it into 4 quadrants. Upper right, upper left, lower right, lower left. So, and also we made some small incisions around the belly button. So we started aspirating those areas. And basically, to make long story short, after we finished aspirating to remove approximately 1.5 liters of fat and saline, then we concentrated on making those cuts. In other words, those areas that we outlined where we think we should aspirate a little bit more to give them the impression of having nice, defined muscles, six-pack. Then we did that. And after we finished with the front, turned him over on his stomach, because also remember some of the flank fat goes all the way, I should say love handles goes all the way around the back. And we turned him on his stomach so we can get to these areas. And basically, when we were finished, we were able to restore the V shape that he usually has. Now, after we restored the V shape, we checked, and then we applied bandages. Now, after that, he would have to wear a girdle, a male girdle, for approximately 4 weeks minimum. And he will also have to get lymphatic massage. Lymphatic massage is a type of massage that gets the fluid, moves the fluid out of the area where we just did the aspiration. And also some of the fluid from the saline solution that we infused under the skin also remaining. So we just, the massage helps with that. And he was done approximately 2 weeks ago. I've seen him on 2 weeks. He's very, very happy. Now, if you go to our website, elegantaestheticsolutions.com, you'll see pictures of before and after. And so, again, Funsculpting is a new modality that we use, and it's safer than most of the other procedures. For example, some of the procedures that are available now, they use heat, like laser, lipolysis. Lipolysis, again, the melting of fat. Also, some of them use cool sculpting, which is cryo, that is to freeze the fat. And whether you overheat it or cool it, that usually tends to cause what's called collateral damage. It's hard to control exactly where you're going to freeze or where you're going to heat. So there tends to be, again, a lot of it depends on who you read and who's putting out the publication. And so Funsculpting tends to be safer than these because, again, using ultrasound to dislodge the fat from these things. So it also, as we said, have fewer side effects because, again, less likely bleeding, less likely of infection. And the downtime is also, pain is a side effect of any surgery. You have some discomfort. No one has said they've had pain yet. The most they've taken is 2 Tylenol. And the gentleman I'm referring to had the procedure on Friday, and he went back to work on Monday. And again, now he's so thankful, he's sending a few more of his friends to, and that's the same thing that happened with a lady that was about, as a matter of fact, this lady is having her wedding this week and had it yesterday. We did her a month prior. She was very, very happy with the result. And she's a lady also that had a gastric bypass. And she had the overhang of fat, had a little apron. Some people call it muffin top. And she was recommended by a friend, and she is very, very happy. And quote unquote, as per her significant other, her boyfriend, because we did a circumferential fat removal, now he thanks me, says, "Doc, now she has a posterior, whereas before there was none. So thank you, Doc. Anything else I can do, Doc?" So that's to say that in terms of body contouring, Funsculpting is the state of the art as compared to the other ones. Other things that we can say, most of the time, one procedure will do it. Now, there are limits as to how much fat we remove. Most physicians or nurse practitioners or people who are trained from sculpting, they will not remove more than 5 liters of fat. Okay, but 2.2 liters, if I remember correctly, is about a gallon. So not too many people are going to remove more than a gallon and a half of fat. Also, it depends what your starting point is, because at that point in time, it becomes unsafe. So in the choosing of someone to do your procedure, just make sure you do your due diligence research, and also make sure that you ask many questions. When the time comes, all your questions are answered. And the other thing is, unfortunately, um, insurance does not cover cosmetic procedures. A lot of people say, "Hey, doc, I've had this gastric bypass. Now I would like to, feel and look my best." But unfortunately, this is a cosmetic procedure. Insurance doesn't cover it. That's the only downside. But shop around, get somebody with experience, get somebody that has done quite a few, that's well trained. And as a physician, I'm biased because I think physicians do it better than anybody else. But you got some great nurse practitioners. You got even some great nurses, depending on which state that you're in, that can do the procedure. And it's all about experience. That's very, very important. And also making sure that all your questions are answered. And currently, Funsculpting is the most requested body contouring system. I have neurologists. I live in Jersey, coming all the way from New York for this procedure. And this neurologist, family members are dermatologists all the way out in another state. So the fact that people in the know are requesting these procedures versus liposuction, cool sculpting, lipolysis, laser lipolysis, and there's some name brands that has also been out there. For example, there's a gentleman that I walk with every morning. He tells me about Sonobello is also one of the procedures that also a lot of people use. But for some reason, that high definition liposuction, which is a level 1 type of blanking on the name, level 1 type of device. Level 1 means it's a very safe device. You don't need to be in an operating room. Very safe, and that's usually determined by the FDA. And so all these are the support that Funsculpting is a procedure that's really, really in high demand. And I believe liposuction, or I should say body contouring, is the procedure that's number 1 in the United States in terms of cosmetic procedure. And last thing I will tell you, like earlier on today, I was talking to my realtor. She's a young lady, about 35 years old, and mid-30s, let's say, and she's done with babies. She's had 2, and she would like to regain her youthful figure. That is the figure that she has prior to the babies. And we were talking about Funsculpting, and she had quite a few questions because she was thinking of going to Guatemala or another country to have it done. And when she asked me, what do? I told her I'm a physician, a surgeon, and I have a med spa in Chatham, New Jersey. And she asked me, well, do you do body contouring? I said, yes. And we started talking. And basically, for the fee that she was supposed to pay, and that's just the fee for the procedure, what she called a mommy makeover, I was able to convince her that she should have the procedure done in this country. Whether I do it or not, that's, again, not relevant. But she should have the procedure in this country, because in the past, I myself, I've had to deal with complications done by other surgeons elsewhere. And here, surgeons or healthcare providers are accountable much more than in these countries. So therefore, it's something to think about. Although she thinks she will save money, and when I tell her that she was going to have a tummy tuck with liposuction, the amount of days she's going to take off from work, added to the cost, added to the lodging that she would have to pay, it'll be a lot more than is required for the Funsculpting. And as of now, she was also concerned about when she has the fat removed, will the loose skin be a problem? I explained to her that loose skin rarely is a problem, and let's say if it is, we can always use another modality to do skin tightening procedure. We could use shockwave therapy, radio frequency, and this is one of the things also we can do. We can also use laser. There's some laser, especially using the modality called Nd:YAG laser, that we can use to do the skin tightening. So that's to say that Funsculpting is becoming very, very broad, and a lot of people who would usually go to another country, particularly Caribbean country, what they call medical tourism, that there's no need for it now because the fact that the surgery is relatively, or the procedure is relatively simple. You don't have to pay for a hospital, anesthesiologist, and all these other ancillary services, that you should be able to get this thing done here. Now, I know a lot of people are interested into where, for those people that may be interested in an evaluation, the evaluation is complimentary provided you get the procedure. That is, you're going to have expert opinion, and if you decided to go with us, Elegant Aesthetic Solutions, Chatham, New Jersey, 973-674-4042. Myself, Dr. Ducheine, and my staff will be very, very happy and feel privileged to customize a solution for you. Now, not only Funsculpting that we do a lot of other things. We do incisionless facelift using lasers. We do micro needling. In other words, we can make you look 10 to 15 years younger with micro needling without surgery. And this procedure takes about a half hour after we numb the face. And again, you go home the same day. But anyway, go to our website, which is easmedspa.com, so you can be more familiar with the procedures or the service that we offer. Now, it's a work in progress because we just opened in November. Our med spa, we're working on it. But if should you have any problem, it's best to call, or you can email us at easmedspa@gmail.com, easmedspa@gmail.com, and we'll be happy to correspond with you, set up an appointment, and see how we can help you to look and feel your best, because that's what we are into. We are into making people feel their best, look their best. Our job is to enhance, just as your confidence. Enhance your confidence is our number one of our mottos, one of the things that we want to do for people, because after all, as we age with time, it's not that we've changed, but we know that when we tend to remember how we used to feel when we were in high school, remember how we used to look, and the degree of confidence that we used to have, so therefore that's our job at ES Med Spa, is to help you look and feel your best. Now, should you have any questions, please feel free to contact us and let us know. We're happy to share our experience with you and be able to take care of you. Thank you. Have a great spring.